Let's move on to the pandemic now, and specifically the modelling. Some of the modelling that created an enormous amount of alarm in Australia at the start of this pandemic. I'm joined from the Sydney CBD by Professor Sally Cripps from Sydney University. Thanks for joining us, Sally. I appreciate it.
It's my pleasure.
Now, first up, we saw some really alarmist models early on that were telling us upwards of 150,000 Australians were going to die from the pandemic. Surely they were worst-case scenarios. Surely the modelling provided other scenarios where it wouldn't be so bad, but we never seem to hear about them.
Well, I think that the trouble with the models were that they've been consistently inaccurate over the entire life of the pandemic. So I think, we should be thinking about how we're going to evaluate models and whether we want to keep using them. The overestimates, I think, back early on in the piece when we had no information, I think then perhaps paying attention to the extreme value and thinking about what we should do then when we have no other information is not a bad thing to do. So short, sharp lockdown is it would be actually a sensible thing to do. But I think as we've learnt a lot as the data's come out, that we're not faced with these terrible costs to life. And in fact, that the costs that the lockdown imposes, while they will save human lives from COVID-19, can have serious consequences on other aspects of health. For example, domestic violence is going up, mental health. There's studies that show that people are dying more of cancer, more of heart attacks. So any model that just takes into account one dimension of a problem, which is to the reduction of COVID deaths, and doesn't look at how it affects the larger issue at hand, is very narrow-minded.
Yeah, modelling, of course, is enormously fraught, and economists try and model what's going to happen with the economy. We talk a lot about climate modellers, of course, but when it comes to the pandemic, was the essential problem here that people just model, statisticians just model the worst-case scenario without factoring in those changes, whether it's treatments or social distancing or just awareness?
I just think actually it was a lot simpler than that. I think we didn't know what we were doing. I think that it's not necessarily the worst case scenario. So we were modelling, we were giving ranges of outcomes. When I say we, I never did the models, but I'm part of the modelling community. And I think that the really important thing is that as they went on and as we started to see the impact of various measures that were made, the models weren't really reflecting it. The study that we did, we were asked by the Journal of International Forecasting, I'm one of a team of 3 that is asked to comment on the modelling for COVID-19. So we found that they just simply continued to be bad even after it was clear that the impact of the virus was not what we thought it was.
So is the point here that they perhaps shouldn't have even bothered with the models early on? They knew nothing, very little about this disease, and certainly on how it would play out in Australia. Was the modelling just superfluous?
Well, it's actually interesting that you raised that point, because that's the guy on the other side, a fellow called Professor Taleb. He's a very famous guy in New York. He argued that point, which is at the beginning, you don't know anything, so we should just be really conservative. And while I agree when 50 million lives across the planet are at stake that that's the case, I think that always doing the conservative thing without considering that there are risks attached to doing the worst case scenario are very short-sighted. So if we continue to take the most risk-averse position, for example, what they did in New York when they increased the number of beds for the onslaught of COVID-19 patients that never came, in order to do that, they moved a lot of COVID-19 patients out of hospitals into nursing homes, which resulted in over 6,000 deaths in those nursing homes. So, it's all very well to talk about being cautious, but when being cautious actually has impacts in other areas, then you get into trouble.
Well, we have to talk about economic modelling too when you're dealing with this pandemic, because there's been a real trade-off between fighting the pandemic and killing the economy. And those models,
yes,
while the models that predicted such disastrous consequences in Australia have been proven wrong because of effective action here, they are probably still holding back state and federal governments from reopening the economy and therefore alleviating all the other pain in the country, i.e. unemployment and the like.
Yes, of course, unemployment, the economic consequences are huge. I've avoided talking about them because I'm just actually not an economist, so I'm not an expert in that area, but common sense would dictate that lockdown is going to have a profound impact on our economic environment in which we operate. So As to whether or not how much the states or the federal government are paying attention, it's very difficult to tell in Australia. I mean, one thing that I'm enormously impressed with is that the modellers in the US actually make their modelling available. So they're producing predictions on a daily basis with prediction intervals so that we can see actually how they're doing. Unfortunately, that doesn't happen in Australia. So I'm really unable to comment on the quality of the models that they use in Australia because they simply don't make those data available.
So we should have the authorities in Australia here making all the data available so we can see their modelling and check it against reality?
Yes, of course. I mean, when you think about it, the way we deal with most crises, if you were, right now they're trying to get a vaccine, they've got to go through clinical trials. We're trying to do it quickly, but they have a process. So here we are in a situation which we've never really been in before in our lifetime. We're trusting to models without any quality control at all. So they could have seen these models were performing very badly. We started writing papers about this back in late March when it became apparent just how bad they were. We had a terrible time trying to get it published. We rang up editors and said, please publish it. We're worried that people are making decisions based on these models, and yet we can see that they're wrong. So we absolutely have to have, it's not that all modelling is wrong, actually. I mean, I really believe that if we learn from our mistakes, that we can do a lot better than we're doing. If we're constantly trying to justify our mistakes, saying, oh, well, we got it wrong because the measures have been so effective, that may or may not be true. It certainly, other countries haven't had lockdown and haven't had the catastrophic losses, although they have had more losses than they would have had they had the lockdown. But as I said before, lockdown is just one part of a much larger picture, and you're ignoring that larger picture.
Fascinating stuff. Thanks for joining us, Professor.
It's my pleasure.
Professor Sally Cripps there from Sydney University. We are learning a lot, and those models certainly were catastrophic, much more catastrophic than anything we've seen unfold in this country and, as the professor said, in other countries.